transition that we are going through,
Yes.
and the many women that I see in my practice who are going through this transition. So we're going to talk about exactly what menopause is, what is the etiology or the background of menopause, how can we treat it with natural herbs, or if people decide to take medication, and what treatments is out there that can affect your quality of life. So what is menopause? Menopause we define in the medical field as the end of your menses for one complete year. It can't be I'm not getting my menses for 3 months and then 6 months later it comes, because there might be a possibility that if you're engaging in marital relations, you could easily get pregnant if you're not using birth control. And we've had women come in and say, oh, I'm 46 years old and I thought my menses was gone, and I came in to find out if I am going through menopause, and then I do a pregnancy test and they're pregnant. So they have to decide what they want to do. So it's not a pathological, it's not a disease, it's normal for us to go through a change. Okay. So a lot of things that can happen with the change or the transition is, number one, bone loss can occur, and number two, sometimes women can also lose their hair. That could be a possibility. There's also changes in the vaginal area. There's dryness, so they have sort of some dryness in the labial area, and sometimes with the dryness, they can get pain.
That's such an unhappy face you have there.
She is unhappy.
It's not that bad.
Well, she's unhappy because she has dyspareunia.
Oh.
And dyspareunia is that when they attempt to have relations, it's very hard for them because of the vaginal dryness and the shrinking of the vaginal tissues, which is known as vaginal atrophy.
Wow.
So symptoms that can occur with menopause are the following. Number one, you could have this surge of heat. I always call it a private summer. And you'll get it for maybe 5 minutes, and then it disappears, and then you go on with what you're doing, and then it comes back again. Of course, again, the atrophy that occurs in the urogenital area, pain when they're attempting to have relations, and also the fact of psychological stress, which could cause insomnia, forgetfulness, that can cause some stress along with what's going on.
Are there statistics that actually show how many women get what?
Yes, there are. So we're looking at the New England Journal of Medicine, and they're saying that a quarter of them might have these severe symptoms,
Right.
when then there's others that do not have any symptoms at all.
Right.
So again, it depends on actually what your mother went through. If your mother had a difficult menopause, there might be a possibility that you also might have a difficult menopause.
And I bet lifestyle has a lot to do with it.
Lifestyle has a lot to do with it, and also your body habitus.
Right.
They're saying that women of color who are voluptuous,
Yeah.
they don't go through as much menopause as thin women.
Wow.
Yeah, because they have built-in estrogen already in their tissues. Isn't that wild?
I want to ask you something about, I don't want to interrupt, but I do want to ask you something about the estrogen thing. I could leave it for later if you'd
Sure,
like.
we're going to talk about that. So signs and symptoms are, number one, if she starts to go into menopause, and let's say she has a relation now, she may be a second marriage, she wants to conceive, it's absolutely difficult to conceive when you're going through these changes. Because sometimes what happens is, it's not that we don't have any estrogen, we have a different type of estrogen, which is called estradiol. It's not the same. It's not like when we were 25, now we're in our 40s, 50s, 60s, and 70s, so our body is changing, but we still have a little bit of that estrogen, but not equal to what we had when we were younger. We also start to get irregular periods, which means you're not getting your menses all the time, might be scanty. You will also have mood swings, which we had talked about, and which are changes. Sometimes you're happy one day, sometimes you're not that happy, almost like going through a PMS.
And that's because of the hormones.
Yes, the
Up
hormones
and
are
down. I
up
mean,
and
just
down.
much like a pregnant woman.
Just
She,
like
you know.
postpartum.
Yeah.
Postpartum, where women actually go through changes because their estrogen and progesterone is all over the place. Please make sure, ladies, that you do get a bone scan. We have a sonographer here. I don't know if you do bone scans at all.
No, well, when I was doing it, it was a radiology thing. Because it did it.
So there is increased bone loss that can happen also with menopause. We said decreased libido because of the dyspareunia. Sometimes because of the vaginal atrophy, we'll get more urinary tract infections. And another thing that women will complain about is incontinence. And usually what I see is stress incontinence. Like if you laugh or you cough, a little bit of the urine will come out. So what we teach our ladies is to do Kegel exercises. And that's squeezing the vaginal muscles for about 5 seconds, taking it all the way up to the top, and then slowly letting down. And we don't want to get to the basement floor. We just want to get to the first floor. So we squeeze and we let go. Squeeze and let go. And that will be an exercise that will help you with stress incontinence. Now, we like women to build up to about 50 Kegels. And you say, well, I don't have time to do 50 Kegels. How can I do that? Yes, you can. When you get up in the morning and you're brushing your teeth, you can do 5. When you're taking a shower and then you're going to brush your hair, you can do 5. By the time you go to the bus station and you're waiting for the bus, you can do 5. And by the end of the day, you've done 50 Kegels. And that will help with stress incontinence. So dyspareunia, of course, women will come in to our offices, especially if they have decreased libido or if they have pain when they're initiating the sexual act. So we sometimes will talk to them about if anything has happened to them in the past, but sometimes there might be some psychological trauma. And sometimes I see this in women in labor. They might go through some trauma that they have experienced in early childhood, and they will have pain that's different from the normal labor pain that they are experiencing. But what happens to women with dyspareunia is how do we make our relationships a little bit more fruitful so that we don't have this pain? And
You know, it's amazing to me. I'm sorry, I thought you were finished. The psychological component that pain is manifested.
yes, psychosomatically.
Yeah.
Because we actually put it in our subconscious,
Right.
and then it's manifested in many different ways.
Yeah.
Right?
During a
So,
time of stress.
during a time of stress, it might come out. Or they'll come in with these phantom things saying, I have abdominal pain, I have back pain, and then when we do a more thorough sexual history, we find out that probably they have been traumatized early on in childhood. Yep.
Wow.
Psychological, if they have had some pelvic trauma, like incest, rape, anything that comes up with that, and they're really too afraid to speak about that. Now, with changes that are occurring in the body as a result of menopause would be the atrophy of the vagina, the lack of lubrication, which would make relations difficult to be initiated. So we, as nurse practitioners, will have a solution for them of how we can actually make their lives a little bit easier when they initiate the act.
So, a woman who has been these social problems or abuse that we see all the time in the news,
Yes.
these problems will persist almost the entire life.
Yes, it's because they have post-traumatic stress syndrome.
And they may not even be aware of it, and it's
Yeah.
manifesting
Right.
itself in a
In
physical
other
way.
ways.
Yeah.
In
Yeah.
other ways.
Yeah.
When I worked in the rape crises, and I was a sexual assault nurse examiner, and they would come in, we had to give them a lot of psychological, counseling, tremendous amount for years, because it's something that they harbor and something that they put in their subconscious, and then it's manifested in other somatic ways.
Well, when you think about it, that act, the sexual act, is the most intimate two human beings could be ever on the planet.
Absolutely.
So when there's a violation there, I mean, it's of course
It's a betrayal.
deep
Yes.
psychological.
Well, now what's going on in the news, right? You're seeing now with the senator that's seeking a seat. So what we try to do is try to emancipate their feelings, sit down with them and talk to them about what's going on in their daily lives, how can they improve themselves if they're having this atrophy or they're upset, what can we do? And how can we actually help to lubricate those tissues that are shrinking and provide some relief? So we have to be sensitive to everything that they say and take time. And hopefully you're a physician, or if you have the advantage of having an advanced nurse practitioner, we take a lot of time to sit there and listen to what women have to say. But as I define menopause, it's a liberation. It's an emancipation, right? Now it's the empty nest, the kids have gone to college, and now you can do what you want to do. You don't have to be obligated now, you're free. So what we try to do is, number one, obtain information, especially everything that's going on in your health care. How can this be related? Do a thorough physical assessment. We do pap smears, we do a breast exam. If we haven't had one, we send you for a mammography. We also do your cholesterol, your test with your CBC to find out if you're anemic. We discuss how you can improve your life through exercise and good diet. Make sure that you have good screening. If we find labs are abnormal, we will send you to your cardiologist because we always work in consultation. And we also do a depression screening, which is very important. Because sometimes we are depressed, but we don't know that we are. So there might be some key questions through the survey that we can answer that perhaps we'll say, listen, I think perhaps we should need a little counseling. Yes.
What about a hormonal panel? I don't, is
It's
that
coming.
part of the?
It's coming. It's coming.
Yeah, because that, I think a lot of doctors, they bypass that, but if they had all the different hormones, to make sure they're in the normal range.
What we do is the FSH and the LH, the follicle stimulating hormone, and we also do the luteinizing hormone. We really don't look at the estrogen level there because it could be a little bit off whack, so we don't count so much on that. We count on how can we help her as far as improving her lifestyle, because sometimes these labs can be skewed.
Yeah, maybe it's now a good time for me to ask about the estrogen because this is the thing that okay, so God made our bodies, and He also made us to be in this time of menopause, whatever, this...
Of thinking.
Right. Whatever it is.
Mm-hmm.
And I know there's a lot to it. I'm in the midst. I'm entering into that time, and I'm actually very excited about it. Thank God I don't have any of these issues, and I think lifestyle is paramount
Yes.
with that, okay? But as far as the estrogen is concerned, I never understood if my body is changing for the latter years and my estrogen is decreasing, why are doctors trying to shove it back in a chemical way?
Well, they're not trying to shove it back in. What they're trying to do is they give you medication if you have these symptoms that are severe.
And that is due to estrogen.
That is due to the decreased levels of estrogen. Not everyone goes through these symptoms.
So maybe if the estrogen decreases too rapid?
No. If it starts to decrease and you start to have these symptoms that you cannot sleep, you cannot concentrate,
They bring it up so that it'll kind of balance
you
everything
out. Right, but not everybody goes through those symptoms.
Right, okay. Thank you for clearing that
Sure.
up.
So what we assess for is number one, like you had said before, the lifestyle.
Mhm.
You know, what is your alcohol consumption? Is your diet low in calcium? How much caffeine are you taking? Do you have a family history of osteoporosis? And we want to make sure you remain active and do regular exercise. And the regular exercise would be just walking. Walking is a great exercise if you walk for an hour every day. And most important, of course, some weight bearing. So if you do some aerobics, if you do any weight bearing, that also helps with your bones. Now, we diagnose it by looking at when was your last menstrual cycle. And then we test the FSH, like I said before, but it's not considered a reliable method because those are the hormones. Because what happens is there is a decline in the ovarian function because now the eggs that you've had when you were 15, because you were born with 1 million eggs, as you get older, the eggs decrease. That's why the best time to have a baby is when you're about 25. Once you hit 30, everything goes downhill.
And people are getting married later, and
And
they're discovering that they can't get pregnant.
Conceive, so-
See, I think it's a misconception. Women think, oh, I'm not ready to have kids. I'll just have them when I want. But the reality is that your body doesn't work that way. By the time you want to have kids, you could be 35 or 40, and it's difficult to become pregnant.
Well,
and,
wait.
and then you only have one kid.
So what happens is now we have these fertility clinics where you come in and we will get eggs from young people, from young women. We pay them at least $10,000 to harvest their eggs. And if you cannot get pregnant, we will do an in vitro and you will get pregnant. And that's where these fertility clinics are coming. Is that ethical or is it not ethical? Imagine that you're having this child, let's say you're having an egg from an 18-year-old and the sperm of your husband united in a petri dish, then it's injected, you become pregnant, and
Well, the
you have
church
this
is
child.
not for that. I mean,
Well,
for
of course not.
Catholics, yeah.
It's not for that, but this is what's happening in the medical world. And when I teach other nurses, I say, how strange that one day somebody would be knocking on the door and say, hi, I'm your son, or hi, I'm your daughter, or how do you know that your daughter will not marry the half brother that you probably gave and
Yeah, it's
donated
weird.
eggs
The
or
whole
sperm?
thing is
Because
weird.
also medical students are donating their sperms for $500.
Yeah, it's also against every natural law there is.
Right.
But
And
they're
every
doing it.
natural way.
Yeah,
of
conception
doing
in a
this.
petri
Yeah,
dish.
yeah.
Yes.
And also just the reality that you have some young person's egg in your body with
Yeah.
your husband's sperm. It's like the whole thing is just
Insane.
crazy.
But I'm telling you that New York, Cornell, NYU are
Of
making
course.
hand over fist money.
Of
And
course.
these students
Because people are desperate.
are actually paying for their college degrees because they are giving their eggs.
Wow.
And in order to get into that program, you know, it costs about the down payment of a house. When these women come in, these Wall Street women, these executives who are 45, 50, the oldest woman who had a baby was 64. She didn't tell us. She said she was in her 50s. And she had twins. But, I mean, do you want to run around with twins at 64? I don't think so.
No.
But that's more of a selfish act because you could donate. And then who's going to take care of these children?
Also, too, you would think just the extraction of the eggs from these women are doing harm to their own bodies.
Yes, they're
Because to
multiplying so much.
Yeah, the whole thing is
The whole
bad,
thing,
yeah.
but I have to bring you up to speed so you know what's going on in the medical
Yeah.
world. Right? So we suggest that if we get a level that's, remember you asked me, well, what would be the level greater than 40 international units per ml? Suggests that perhaps she's going into menopause, but it doesn't predict when ovulation would occur. So management, what do we do? I like to treat women naturally, but sometimes women want to get something that helps a little bit more, and that's when we talk about, especially if they have severe vasomotor symptoms, then I will consult with the physician, especially if she has no chronic illnesses, no high blood pressure, no cardiac problems, but perhaps putting her on for a short time on hormonal replacement therapy, which is estrogen and progesterone together. You take one pill every single day. I think it's natural when people just do the natural stuff. And where would we find estrogen naturally? Yam has a lot of estrogen. That's one thing that we can do. Sometimes you can just dress in layers, and as you're getting this private summer, just take some of the layers off. Use some lavender oil on your pillowcase if you're having some insomnia, some warm milk. That also
Clary
helps.
sage is an essential oil
Yes.
that's very good for hormones. Very, very good.
And sometimes we also have to look at many times the labels that we're taking, like in Whole Food stores or in these pharmacies that are holistic, they might not contain the exact content to help with your symptoms. You have to be very careful. And herbs never replace, are never a replacement if you have an emergency crisis. You need to go to the hospital.
What herbs do you suggest? What are your recommendations?
Okay, so
Oh,
these
there
are
you
some.
go.
You're always one step ahead of me.
I'm sorry. You're
So
very
these are-
kind.
So these are some of the common botanical therapies that I use. Black cohosh is great because it helps with hot flashes. Don Quai, which I took hot flashes, has been wonderful, and we also have seen clinical trials that it's very effective. Evening primrose is wonderful also for help for hot flashes. Ginkgo. Now sometimes we get a little forgetful, so ginkgo will help memory and cognitive function. And ginseng, the Chinese, Korean, or Asian, if you go down to Chinatown, you get relief of hot flashes with these. And this one, ginseng, they haven't been conclusive in clinical trials, but Don Quai has. It has been very, very
Can I
good.
say something about the
Yes.
hot flashes? They say that caffeine, alcohol, and spicy foods
Yes.
will instigate the hot flashes.
Yes.
So that's 3 things to keep in check.
Yes.
You know, your caffeine, your alcohol consumption, and spicy foods.
So let's say, for example, she says, you know, the Don Quai doesn't work anymore. I need something stronger because these hot flashes are coming even stronger than ever, and I can't really function at my job, and I can't really think, and I can't sleep at night. That's when we suggest, well, maybe you should try for a short trial hormonal replacement therapy. But remember that hormonal replacement therapy, the problem was that there was an increased risk of breast cancer, could happen, a heart attack, Stroke can happen also, and there might be a possibility of blood clots.
All the things we're trying to avoid in this
Exactly.
life.
As long as she wants to sleep. And she doesn't want to sweat. Okay, now the risk, of course, that we said before is blood clots. The same thing that there's a risk of birth control pills and patches in the ring. Although there's even a greater increase as you get older. They actually did this study in women who were 60 to 65, and they found that there was an increase in breast cancer. We also see that estrogen alone is only given to women who've had a hysterectomy. So in order for us to prescribe hormonal replacement therapy, we have to give you both estrogen and progesterone. That's why we ask you, have you had a hysterectomy? And if you haven't had one, if you've had one, then we will give you estrogen cream. And of course, it's been very good. People say they're very happy with taking hormonal replacement therapy for a short period of time. So, we try to do the best for them. Depression is another thing we recommend if you're entering into the pause state. Low dose oral contraceptives has some estrogen and progesterone. That would be very good for them, especially it controls their mood swings. We also might provide, of course, a screening just in the event that she might need something extra besides the HRT or perhaps the birth control pill. She might need some medication for her mind, like Buspar. We might talk about that, of how it's affecting her life. Okay? So what does the experts say? Nobody agrees. All these societies, the Americans, the North American Menopause Society, the Society for Reproductive Health, the Endocrine Society, they take a position that we want to be able to make them as healthy as possible, and if they need to take hormonal replacement therapy, then they should choose, especially if the symptoms are severe and the vaginal dryness is too much for them. So the most effective is to give the lowest dose, and what we do is we also prescribe creams for them, so that they can have the comfort if they're engaging in relations. Okay? The hot flashes will require a higher dose of estrogen, so we have to boost it up so that it'll affect the entire body. And women who have a uterus take progesterone along with estrogen to prevent cancer of the uterus. So we're going to find out if you've had a hysterectomy. The maximum that you can take hormonal replacement therapy is for 5 years. Now I have patients who have been on it longer than 5 years. The method of administration, both estrogen and progesterone are prescribed, and of course it helps with the lining of the uterus. And any time that if you've been menopausal, if you have any vaginal bleeding, it's a danger. It could be a sign of cancer. So we would have
After you're past your year,
Yes.
and then you know you're in menopause. Any
then
bleeding after that?
Any bleeding after that.
Okay,
yes.
that's good to know.
Yeah. Now we have, if you don't want to take the pill, we have what is called Eva Mist. You put this little mist up your nose and it helps it. It's sort of like an estradiol sort of thermal spray that will help with your hot flashes. So people sometimes don't want to take pills, they might do a little spray.
Little
Now, we always will tell them that if we're prescribing estrogen and progesterone, there's a risk of blood clot. That's what's known as thromboembolic. We have to teach them the signs of a deep vein thrombosis, which would be if you're walking and you have this pinching pain in your calf muscle. As you flex or dorsiflex your foot, that could reflect that perhaps there might be a clot that might be traveling. We'll take a look at your leg, especially the calf muscles, to see if it's red, tender. If you have any chest pain or shortness of breath, means the clot is traveling to the pulmonary area. We will do a physical exam, send you immediately to the emergency room and start blood
Is
thinners.
this from women that are actually on the prescribed?
Yes.
Okay, so this doesn't apply to women that aren't on medication?
No.
And so that bleeding after the year, does that also apply only
Yes,
to
to
women?
both.
Oh, to both, okay.
To both.
Okay.
Yes. Because if she starts to bleed after the 1 year of menopause, it's not normal. It's a buildup of the lining of the endometrium of the uterus, and we would have to either stop the HRT if she's on it, or do a scraping and find out if there are cancerous cells.
Right.
Okay. So, breast cancer survivors, of course, we will give them We look at their blood pressure. We also prescribe for them some clonidine, which will help tremendously. If she has, for example, depression and she's a breast cancer survivor, antidepressants might help, like SSRIs, and gabapentin, which is also an anti-seizure drug, will help also with treating hot flashes. So you don't have to use HRT. These are some of the things that we prescribe for women. Yes.
Okay, two things. I was actually on gabapentin for about a week because I had nerve issues, neck and in my armpit area,
Was that more,
radial nerve. Excuse me?
was it fibromyalgia?
No, I had a problem with my neck and I had frozen shoulders some years back and I was just working too hard. But in any event, so the doctor put me on gabapentin, which side effect, it messes with your eyes completely. So I opted not for that. I find that to be a weird medication for hot flashes, quite honestly.
Yeah.
So after a week, I got off of that myself. Serotonin, I want to talk a little bit about that because serotonin is obviously the feel-good chemical, right? But there are so many ways that you can naturally increase your serotonin. Exercise increases your serotonin.
Let's say she can't exercise because maybe she has some problems with her joints.
Okay, I always think no matter what the situation is, because there's chronic severe arthritis in my family, so I know all about joints. And I always feel there's always something you can do. I mean, you don't have to run a race, but it's important to move no matter what. So obviously, any movement or stretching would aid that person no matter what, because there's a lot of brain chemistry with exercise.
Even with yoga.
Yes, so which is very, very good.
Yes.
You know, think
and
about
Tai Chi, which is excellent for people who have joint problems.
right. So people can do something. The other thing is like what is it called? Saffron.
Yes, saffron.
Increases your serotonin. Even a hug increases your serotonin. So there are so many ways naturally. Also, essential oils, you know, those are always my go-to, that there are natural ways to increase your serotonin even for the hot flashes. I mean, I would more like to see a woman use some clary sage or lavender. I mean, someone once said, which essential oil should I use? And the answer is always the one you have, right? Because it's always so good. So there's so many natural ways to combat it. I just don't want people to think that they immediately have to have a prescription.
But that's the clientele.
Yeah, that is, and I'm quite sure, and good thing that they have you, because you have a lot of knowledge and a keen interest in helping people to be well naturally. That's the only way we can ultimately be well, if we seek the natural means, right?
True, but there are some clients, I will say, that sometimes they can't go the natural way and they need a little extra help.
Yeah, of
So
course.
that's
I
why
would never rule it out.
Yeah. So
But just not
we
as
try
an
the
immediate-
natural, and then they come back to me and say, Sandra, I just can't do this anymore. You know, what do you have out there? And I say, you really want to sleep, you really want to relax and just relax a bit. So I might think about giving him something.
Right,
But that would be like the last resort.
right.
So what we try to do is, number one, we try to teach healthy. We're always teaching, we're always going over the diet. We're talking about what you said, behavioral strategies, changes that we can do. We discuss about their sexual responses and their libido. And we tell them, evaluate yourself and say how great you still are, even if you've gone through that transition. It's not, you haven't failed, you're just moving on to another pause.
I think it's a wonderful time of
Yes.
life. You know, it
And that's how I
really is.
feel.
And it's very natural because you have all that estrogen, so you want to be able to rear all those kids.
Yes.
And you dote as a young mom. As you get older, you don't feel like doting too much anymore, and that's quite natural, and it kind of frees you up to do other things. And you know, God has plans for the second half.
That's right.
Yeah, it's pretty exciting.
So I hope, do you have any questions at all? I hope this has been at least helped. Has been at least helped. Has been at least helped. Has been